everyone, this is Dr. Karl Yousef. I'm a board-certified emergency doctor. Today, I'm going to talk to you about one of the top, scariest cases that I've had in the emergency department. From babies not breathing to a man's face and mouth swelling so much that it would suffocate him, and even a man's scalp being ripped off of his head. These are real and very scary cases I've had that have made my heart pound in my chest.
My finger has a heartbeat.
I'll take you through exactly what happened and how I handled it. Some details are changed to protect patient identities. I was told a car crash patient was coming in. I never know what to expect, so I'm always running through worst case scenarios in my head. Our nurses mentioned that EMS reported a lot of bleeding from his head and that his blood pressure was incredibly low. That's always scary because I know that a patient is losing a lot of blood, especially when his blood vessels could actually be contracting during this stressful time. Okay, so patient comes in, he's about 35 years old, and blood is pouring out of his head. He's actually talking, but he can't remember anything, and he's yelling in pain. That means one thing to me in the emergency department: his airway is actually clear. That's a critical factor when I'm assessing any patient because that's likely the first thing to cause death. So he's breathing fast, but he's breathing. I quickly look at him and I'm not seeing any other injuries. So my eyes go right to his head. We unwrap a bulky dressing from around his head and immediately I see that the skin of his scalp has completely come off of his skull. Yikes. This means that from his forehead, you could lift the skin off of his skull all in one piece, like a wig, and all you would see underneath is bone. This is called a degloving injury, and it's exactly what it sounds like. It's when the skin is ripped off of the bone as if you're taking off a glove. Additionally, the scalp has a very robust blood supply, which means that when it gets injured, it bleeds a lot. There are a lot of arteries in the scalp. We tried stuffing gauze pads between his skull and the skin of his head, but the bleeding kept going and I couldn't stop it.
'Tis but a scratch.
To make things worse, he was screaming and becoming combative.
Chicken! Chicken!
Meaning he's becoming delirious and might not be aware of what's happening. We immediately had to start IV blood for him because he was losing way too much blood. In addition, I knew I had to give him something that would decrease his pain and dissociate him from the chaos and the reality of what was happening. I knew ketamine would work well because it doesn't stop him from breathing, helps with pain, and takes him into a dreamland. So we gave him some ketamine, and that helped. But nothing was working to stop this bleeding, and I didn't know if we were going to be able to keep up with him from hemorrhaging out. All right, so I called for the largest sutures we have. I started stuffing gauze pads again between his skull and the skin of his head. And this time I started suturing the skin over the gauze pads to try to create pressure to stop the bleeding. After 30 brutal, long minutes, we were finally able to get some control over the bleeding. Not 100%, but enough that we can start to think about our next steps. Luckily, a surgeon was able to get the operating room ready. They took him immediately, and in a more controlled setting, were able to target the bleeding arteries and stop him from hemorrhaging to death. This was probably my longest, heart-racing case, and it felt hopeless because nothing I was doing was working. I was definitely thankful that he didn't hemorrhage to death and that we had surgical resources at the hospital to help us out. Whew. All right, for more crazy cases just like these, hit the subscribe button. And also, tell me what you want to hear about in the comments. This is Dr. Karl Yousef, and I'll see you on our next video.